A sentence that starts clearly and just stops. A word that was right there and now isn't. A task that used to take less effort. Between 10 and 40% of adults over 60 may have B12 levels below what their brain needs, a range that reflects different research definitions of insufficiency. If those numbers sound familiar, the question seems obvious. But the research has a more specific answer. It depends on one thing most people over 60 have never had checked. Brain fog after 60 is one of the most commonly reported and least satisfying complaints to bring to a doctor. You describe it. The doctor checks the standard markers. Everything comes back in range, and you leave with a reassurance that doesn't quite match what you're actually experiencing. What you're living with isn't nothing. Studies consistently document this pattern in adults over 60, and the research has names for what you're describing. B12 is one of them, a real one. But the story is more specific than most supplement labels suggest. In this video, you'll learn what the research actually shows about B12 and the aging brain, what it does when there's a real deficiency, what the evidence says about supplementing when there isn't one, and who is genuinely at elevated risk after 60. You'll also hear about one specific action, a simple blood test, that the research consistently points to as the most useful first step before spending another month on a supplement that may not be addressing your actual situation. Vitamin B12 plays two critical roles in the central nervous system. The first is myelin, the insulation wrapped around nerve fibers. Myelin is what allows electrical signals to travel efficiently between neurons. Without adequate B12, myelin production is impaired. Signals slow down. The brain that used to run cleanly starts running with friction. The second role, B12, helps convert a compound called homocysteine. When B12 falls too low, homocysteine accumulates, and elevated homocysteine is neurotoxic, damaging the blood vessels that supply the brain. When deficiency becomes clinically significant, the effects are well established: fatigue, memory difficulties, the fog. These are documented outcomes of a vitamin the nervous system genuinely cannot function without. B12 absorption depends on intrinsic factor, a substance the stomach produces. With age, gastric acid declines. Less acid means less intrinsic factor. Less intrinsic factor means less B12 absorbed, even when the diet hasn't changed. The NIH estimates clinical deficiency affects roughly 5% of adults over 60. Milder insufficiency, by levels below optimal without meeting formal criteria, ranges from 10 to 40% depending on the threshold used. The same fog. No formal diagnosis. That's the mechanism. But what does the research actually show when you test whether those supplements address the fog? That's where the findings become important to understand. Here is the part of the B12 and brain fog conversation that gets left out. If you do not have a B12 deficiency, supplementing with B12 will not improve your cognitive function, it will not clear the fog, it will not sharpen your memory. This is not a cautious reading of the evidence. This is what peer-reviewed systematic reviews consistently show. A 2021 systematic review and meta-analysis published in the journal Nutrients specifically examined this question. 16 randomized controlled trials, more than 6,000 older adult participants, all with normal or subclinical B12 levels without advanced neurological disorders. The conclusion was stated plainly: high-quality evidence for the absence of treatment effects on cognitive function. No meaningful benefit to memory, to concentration, to cognitive clarity. The landmark Cochrane review on B12 and cognition reached a parallel finding. In adults who did have low B12 levels and dementia, supplementation still showed no statistically significant improvement in cognitive function. This matters because of how B12 is positioned. The connection between B12 and cognitive health is real. We documented that mechanism in detail in the first section, but the connection only runs in one specific direction. Correcting a deficiency that exists, yes. The research documents meaningful improvement. Supplementing when there is no deficiency, no. The research does not support cognitive benefit. The practical consequence is significant. Without the test, you can spend months taking a supplement, genuinely believing you're addressing the cause of your fog, while the actual cause continues unaddressed. Brain fog after 60 has multiple possible causes: sleep disruption, thyroid imbalance, vitamin D insufficiency, cardiovascular changes, medication side effects. None of these respond to B12. Without the test, you are treating a deficiency you may not have, while another cause, sleep, thyroid function, or vitamin D, goes unaddressed. The research on B12 is not a reason for pessimism. It is a reason for precision, and precision starts with knowing where you actually stand. Now, who is actually at elevated risk, and what are the specific situations where that test becomes especially important to request? The research identifies 3 situations that meaningfully elevate B12 insufficiency risk in adults over 60. Age alone, the absorption changes we discussed, declining gastric acid, reduced intrinsic factor production, affect the general aging population, not just people with specific conditions. Being over 60 is itself the first risk factor. Metformin use. This medication, widely prescribed for blood sugar management in adults with diabetes or prediabetes, is specifically documented by the NIH Office of Dietary Supplements as reducing B12 absorption. If you take metformin regularly and have been experiencing cognitive symptoms, your B12 levels are worth checking. The medication itself may be contributing to lower levels. Acid-suppressing medications. Proton pump inhibitors, not commonly prescribed for acid reflux, work by reducing stomach acid production. That same reduction affects the stomach's ability to release B12 from food. Long-term use of these medications is associated with lower B12 levels, according to the NIH Office of Dietary Supplements. Metformin and acid-suppressing medications both affect how your body absorbs B12. If you take either, please discuss B12 supplementation with your pharmacist before starting. If you follow a vegetarian or vegan diet, B12 also deserves regular attention. The primary dietary sources are animal products. Without them, monitoring or supplementation is generally recommended by nutrition guidelines. In each of these situations, and in fact, for any adult over 60 living with unexplained brain fog, the research points to the same practical first step. Ask your doctor for a B12 blood test. It is a simple panel, often included in standard blood work. It tells you whether a deficiency or insufficiency is contributing to what you're experiencing or whether it isn't, which means you need to look elsewhere. Here is the thread that connects what we have covered. B12. deficiency after 60 is real. The neurological effects are real. The elevated risk in this age group is real, but the research is equally clear that supplementing without a documented deficiency does not move the cognitive needle. The test is not the last step. It is the first. If you have been experiencing brain fog and wondering whether B12 is the explanation, here is what the research tells you. Not buy the supplement. Not wait and see. Ask your doctor for the test. It is a simple blood panel. It requires one conversation. If you take metformin or a reflux medication, mention it. Those drugs directly affect where your B12 levels land, and your doctor needs that information to give you an accurate picture. If the test shows a real deficiency, you have a documented treatable cause, something behind the fog that can be corrected. That is genuinely good news, because deficiency is correctable. If the test shows adequate levels, the answer is somewhere else. And knowing that means you can start looking in the right direction instead of spending more months on something that is not addressing your actual situation. Your brain fog is real. The research recognizes it. And the simple test that tells you what is actually behind it, that test is available to you. Have you ever had your B12 levels checked? And was the result what you expected? Tell me in the comments. I read every one. Subscribe to Brain Health After 60. Next, 5 early signs your brain is asking for more support after 60, and what the research says about each one. This channel translates peer-reviewed research into educational content. The voiceover is AI-generated. Full sources and disclaimers are in the description. Thank you for watching.